My name is Lucky, and I'll be presenting arthritis today, where we'll talk about management tips and the route to total freedom. Today, we're going to be talking about the human bones and joints, because we can't talk about arthritis without having a brief look at what of the human bones and joints, which is actually where we're talking about our point of focus for today. We define arthritis, talk about the types, signs and symptoms, causes and risk factors, complications, and more. Now, the human skeletal system. It's worthy of note that the human skeletal system or bone structure is the internal support framework of the body, and it's made up of bones and joints. 270 bones at birth, and this goes down to 206 as they fuse as we mature into adults, and it's 14% of our total body weight. Bear in mind that it's composed of calcium, chondroitin sulfate, hydroxyapatite, oxygen, and hydrogen, which is part of a hydroxyapatite. Now, I want us to take a close look at this calcium, chondroitin sulfate, phosphorus, because we're going to refer back to this. That's a basic structure of the human skeleton over there. Now, what are the functions? Support, definitely as the framework. Protection is skull. Then the spinal cord runs down through vertebrae, spinal column, and is protected by it. It also helps to coordinate movement. Imagine not having muscles, having bones muscles connected to bones and all that. Movement would be impossible. Fun fact: blood cell production. Blood cells are actually produced in the bone marrow as one of the places, points of production. Then we have storage. Yes, it's a very good source, storage point for calcium in the body. And in fact, what will tickle your fancy tonight is that one thing that will tickle your fancy is that you find out that it also has hormonal function, because the bone cells themselves secrete what is called osteocalcin, which is very important in insulin regulation, male fertility, brain function and development, and muscle function, amongst others. You see, now we have now the human skeletal system is basically defined as what makes it comes together to the bones come together, connect at the joints to make the human skeletal system a functional whole. You understand? Now, they differ based on location and function. I'm talking about different types of joints here. And we have hinge joints, ball and socket joints, as aforementioned, fibrous and suture joints. As you can see, these are suture joints in the brain, the vertebral disc here. Take note of how it pads these two bones here. And this is the knee, and you can see how it connects the two long bones of the legs, We have different types of cartilage. Cartilage are basically what make up these paddings that actually help us at the points of contact between bones in the body. Now, we have the three types of cartilage. Basically, we have hyaline cartilage, elastic cartilage, and fibrous cartilage located all over the body and serving different functions in order to, basically give us paddings, structural support, and also reduce friction between bones and joints. This is an example of different types of cartilage. We have hyaline cartilage. You can see the chondrocytes, which are the cells that basically make up cartilage. And with different types of different areas and location and function, we have different types. But bear in mind that surrounding these chondrocytes are what we call the extracellular matrix. This is very, very crucial, and is secreted by these chondrocytes to help them to suspend them in that matrix called a cartilage, in order to have a very sound cushion at the junction and or a slippery surface, as the case may be, depending on the location of the joint. And bear this in mind, because without this matrix here, this cartilage will not be able to have this function. This matrix imbibes water, takes in water, and it maintains the integrity of the cartilage, thanks to the chondrocytes that secrete them. Now, arthritis is simply defined as painful inflammatory disorder and or stiffness of joints. It's coined from the Greek literature, meaning disease of the joint. They are also known as rheumatoid diseases. Now, bear in mind that rheumatism often refers to a form of arthritis called rheumatoid arthritis. So when you hear an elderly woman in the village saying she has rheumatism, at least you have an idea of what it is. Now, there are over 100 types of arthritis, but more commonly are one, osteoarthritis. This is in fact the most common form of arthritis, also known as degenerative joint disease. Degenerative in the sense that the joint breaks down as people age as a result of wear and tear. Now, it's mostly as a result of mechanical and little inflammatory influence, and is often as the weight-bearing joints like the back, waist, and knee, because of the mechanical pattern with which it emanates. Okay, now we have, this is an example of a healthy spine, and you can see that this spine here has lost its cartilage, and that's where osteoarthritis comes in. It's an example of what osteoarthritis can do to the knee. Over here, we have a healthy cartilage. The extracellular matrix is in order. The chondrocytes are there producing enough material, the glycosaminoglycans, elastin, collagen, and other necessary components that keep the cartilage healthy to make it slippery enough for our knee to function. Here we can see someone already having issues as a result of osteoarthritis, and the cartilage is already wearing off, and you can see fragments of bone here attempting to touch each other, and you can imagine what the frictional pain this person will be feeling will be like. Now, rheumatoid arthritis, first thing you should know about this is that it's an autoimmune disorder. It's chronic, and what it means is that the body is attacking itself. You know, that often affects joints of the fingers, wrists, shoulders, knees, and elbows, and involves attack of the joint lining called the synovial membrane. Now, this membrane is what, like in the knee here, you can see that this membrane is what is keeping these joints together as a whole. Now, imagine in this other picture here, you can see that rheumatoid arthritis has begun to destroy this membrane and attack even the cartilage that is protecting these two bones from touching each other, and hence people have a lot of pain. Now, and this eventually leads to the erosion of the two opposing bones at the affected joints. It also affects other organs of the body like the lungs, the heart, the skin, nerves, and blood. In fact, rheumatoid arthritis is notorious enough to cause anemia. It's a unique form of arthritis in the sense that it is often as a result of the kind of things we eat. Now, it was formerly known as the king's disease because it often used to happen to kings and rich men who could afford to indulge in the risk factors that actually lead to it. Now, you see, the great toe is often being affected, and these uric acid crystals often often deposits in areas such as this. As you can see, this is someone's bone, and this is the uric acid crystal. These are the uric acid crystals. This is what they look like under the microscope. Imagine moving and something like pins are actually pricking you from inside your skin at your joints. What a terrible pain it is. Ankylosing spondylitis is basically a form of rheumatoid arthritis of the spine. What it means is that the spine is actually having a form of rheumatoid arthritis, as earlier explained, an autoimmune issue. But the difference here is that it often doesn't present with what we call the rheumatoid factor. We have infectious or septic arthritis, which occurs as a result of infection at the joints. Reactive arthritis is the same or is similar to septic arthritis, as a septic arthritis, but it's just that the infection happens on that side of the body, and arthritis results as a result of that. And we have lupus and more. Now, what are the symptoms? Generally, pain is a general symptom of arthritis, but it may include swelling, reddening, aching, and or stiffness around the joints, and it may affect other parts of the body as well. Just as we earlier explained in rheumatoid arthritis and lupus. As you can see, all forms of pain at the joints can actually take place as a result of arthritis. But let us not also forget fatigue, weight loss, poor sleep, and anemia once again. So these are just a few of an idea of the different specific type of things that happen when people have different types of arthritis. Now, it often affects one side. I'm talking about osteoarthritis, and more than the other. Then crepitus is a sound that happens when the knee is moving because of that crackling sound as a result of the worn out cartilage at the junction where there's supposed to be some cartilage. Now, we also have rheumatoid arthritis. Now, rheumatoid arthritis also has pain, but there's a unique type of thing that happens with it. It also has swelling, reddening at the joint, fever, and sometimes presents with skin rash and all that. Gouty arthritis, of course, with pain, and tophi, which are swellings on the skin, as well as kidney stones. Now, generally, any factor that affects the structural integrity of the joints and bones may lead to arthritis. Well, with osteoarthritis, aging, daily wear and tear of cartilage associated with aging, the chondrocytes lose the ability to maintain the structural integrity of the cartilage, injury to the joints, genetic factors, obesity, which is excessive, as we mentioned before. It also attacks the weight-bearing parts of the body. So being overweight already makes it worse. Interestingly, diabetes makes this worse. Jobs with high joint stress, lack of exercise, and more. Now, for rheumatoid arthritis, there's something unique about it. The causes are generally unknown, but the risk factors are influenced by genetic and environmental factors like smoking. Now, vitamin D deficiency will also predispose one to this. And it's always advisable to avoid smoking because it damages that in the body. You can't count them. Then gouty arthritis, smoking as well, being overweight, then high red meat and beer intake. As you can see, this young man here relaxing inside the bottle. That's the guy takes alcohol to the extent now he's comfortable sleeping inside the bottle, and then genetic factors also affect it as well. Now, infectious or septic arthritis as a result of infections, basically, at the joints. Now, complications as a result of arthritis. Now, the first thing is chronic pain, unbearable pain, immobility, decreased range of motion, disability, because it's one of the major causes of disability in Nigeria and in the world. Joint effusion simply means where the knee begins to swell as a result of the terrible things that happen as a result of arthritis. There's muscle loss. As you don't use your muscles because of pain, the muscles begin to disappear. Let me put it that way, although medically we say atrophied. Then structural and postural deformities, as often with the case with ankylosing spondylitis, osteoporosis or weak bones, inflammation, kidney damage, bone damage, paralysis. In fact, the most important here is the economic issue these days, because the inability of one person or someone to move, how do you make money without moving? And then when you don't have enough money, you find it difficult to treat the problem. So the person is in a loop. No money, problem, problem, no money. So that's one of the worst things that can happen to someone. Of course, insomnia and depression. Anemia, as mentioned, aforementioned rheumatoid arthritis, cardiovascular diseases, skin diseases, like tophi, as the swelling in this, on the skin. Now, how do we diagnose this? Clinical examination by appropriate healthcare professionals, often by observation. Then we have radiologic tests and blood tests. As mentioned, rheumatoid factor, anti-nuclear factor. When the body is attacking itself, anti-nuclear factor begins to accumulate to show that there's a problem. That's the guy over there assessing somebody. I wonder who he's assessing. Now, epidemiology of arthritis in Nigeria, about 30% of women by the age of 65 have osteoarthritis. It is the first leading cause of disability on earth, affecting about 3% of the world population. Rheumatoid arthritis affects more women than men in Nigeria. That's a fact. And arthritis is a leading cause of disability in Nigeria. Now, these are the things that complicate treatment or management of arthritis. These are the issues, management of arthritis. Absenteeism. Sometimes the kind of pain the patient is feeling, that he just miss the doctor's appointment or the healthcare provider's appointment. Peptic ulcer disease, as a result of the pain reliever, because of the pain caused by the arthritis, one takes pain relievers that also can actually aggravate peptic ulcer diseases. Economic issues, as aforementioned, poor health infrastructure, lack of committed healthcare providers, and poor health information system. I suggest anyone that has this issue should quickly seek help before it is too late. Now, management and prevention of arthritis. Now, these are based on the type of arthritis and include weight loss, as with osteoarthritis, as we know it's of a mechanical origin. You have to quit smoking in cases of rheumatoid arthritis first, amongst others, physiotherapy, avoid alcoholism, the King's disease, remember, gouty arthritis, exercise, and what I call thermotherapy, sometimes alternate application of ice and heat, rest, surgery, use of appropriate orthodox medication. These will give symptomatic relief, and then use of supplements to adequately prevent and or reverse arthritis, as the case may be. Now, how do supplements help in the management of arthritis? First, they reduce inflammation on the affected joints, replace lost minerals like calcium, provide essential vitamins for bone healing. They enhance production of extracellular matrix and materials around, around the chondrocytes. For instance, glycosaminoglycan, collagen, and elastin as well. And they enhance healing and rejuvenation of bones and joints. They protect DNA from damage at joints and bones, because faulty DNA lead to production of faulty proteins and biochemicals, worsening the situation. Now, they rejuvenate and protect the heart, lungs, kidneys, and other organs from damage by arthritis, caused by maybe things like rheumatoid arthritis or systemic lupus erythematosus, SLE, which is also causes some form of arthritis, where the body attacks its own self for reasons best known to God. Promotes and improve muscle mass, enhancing posture and stamina. Yes, because as a result of lack of use of muscles, because of the terrible pain that is felt as a result of arthritis, people tend to allow their muscles to just atrophy or disappear, in quotes, as a result of lack of use. Now, they help to dissolve and resolve kidney stones. I'll tell you more about that when we get to lecithin and all. They fight infections at joints thanks to one or two supplements, and of course, reverse anemia, which is one of the complications of rheumatoid arthritis. And they also help in weight management. Weight management is essential because one having osteoarthritis automatically means that the mechanical pressure on the joints that are already being worn, are already wearing and tearing, is now going to get worse, quickening the damage caused on the bones and the joints as they grind harder on each other, and they supply, of course, essential molecules for healthy joints and joint healing. Just to mention a few or one or two supplements that can actually help with this, we have Freedom, which contains chondroitin and glucosamine sulfate. If you can remember earlier, when I mentioned the extracellular matrix that surrounds the chondrocytes, that's the cells that actually make up the cartilage. Now, these they help to improve the padding and hence hinder wear and tear. By padding as adequately, the bones don't rub against each other. Now, it also contains, I'm talking about Forever Freedom here. Now, it contains methylsulfonylmethane, a wonder molecule for prevention and management of joint disease, arthritis. Also contains a high amount of aloe gel with, in fact, uncountable qualities, but most notably anti-inflammatory, analgesic, and adaptogenic or rejuvenating qualities and more. Glucosamine is essential for bone formation and maintenance of the integrity of the bone as well as the cartilage of the joint, hence preventing osteoporosis, which is popularly known as weak bones. Forever Move is an amazing supplement. It's worthy of note that it is 5 times more effective than supplements that contain chondroitin and glucosamine. It contains chondroitin, glycosaminoglycans, collagen, hyaluronic acid, which is very, very important in hyaline cartilage, which is also very, in fact, hyaline cartilage is located basically almost all over the body and is involved with a lot of lubrication and padding, and it's also essential it also helps in joint protection and rejuvenation by maintaining the structural integrity of chondrocytes or cartilage cells and improve production of chondrocytes, extracellular matrix. This extracellular matrix, if you remember, is what suspends these chondrocytes that make up the cartilage. Being healthy, having enough or adequate extracellular matrix ensures adequate padding of the joints, which is also very essential to prevent rubbing together of the bones, as aforementioned. And it also contains curcumin, which is an antioxidant, amongst others. Bear in mind that an antioxidant is a free radical which acts against an antioxidant acts against free radicals and reactive oxidative species which attack DNA and hinder the proper production of the biomolecules and proteins necessary to maintain the integrity of the joints. Now, Forever Calcium is amazing in the sense that it contains dicalcium malate. Bear in mind that dicalcium malate lasts longer in the blood, thereby ensuring a constant supply of calcium where is needed. Now we have magnesium, manganese, zinc, of course for immunity, copper, and 1,2,5-dihydrocholecalciferol, also popularly known as vitamin D. We have vitamin C, which is an antioxidant, amongst others. Bear in mind that as a bonus, it's also good for development and maintenance of healthy teeth. I had a patient that the kid's teeth refused to grow, and for no reason, I gave her this Forever Calcium, and by God's grace, I think her children are happy with wonderful smiles. Now, aloe gel. If we're going to start talking about this product, then we're not going to leave here today. But bear in mind that it has these aforementioned qualities, and it's also a somatic stem cell stimulant. That means if there's damage to the cells and the cells have died or are dying, it will have better chance of survival as they are going to be rejuvenated and regrown by somatic stem cell system. Garlic thyme helps to purify the blood of uric acid. This is amazing for gouty arthritis. Hence, it reverses the negative effect of gouty arthritis. As a bonus, it helps to reverse the formation of kidney stones because of the high uric acid level in the blood of people that have gouty arthritis. Now, it also helps fight against free radicals because it's a powerful antioxidant and helps to prevent DNA damage. Arctic sea contains omega-3 and omega-6 fatty acids. And as a result of the discovery, scientists have found out that immunity plays a very vital role in healing of bones. And talking about arthritis is like talking about damage of bones. Nature mean contains phosphorus, which is a very important component of the bones, and as well as zinc, manganese, magnesium, and more. We have forever active HA, which contains hyaluronic acid, the basic component in hyaline cartilage. Cardio health helps to reverse damage as a result of heart, lungs, liver, kidneys as a result of rheumatoid arthritis. And as a bonus, it helps to reverse hypertension. Aloe heat, especially formulated with eucalyptus oil, sesame seed, and apricot oil for soothing relief from rheumatoid arthritis. It works even better in combination with MSM gel, which I mentioned as a wonder molecule of methylsulfonyl methane, which is essential in tackling the pains and the symptoms associated with arthritis, especially osteoarthritis. Now, I want to talk about infinite Fermin complex. Bearing in mind that the extracellular matrix contains collagen, this infinite Fermin complex helps to replenish this collagen, and which in turn helps to maintain the structural integrity of the cartilage, and in turn helps to mitigate the side effects of arthritis. Bee propolis has been used for thousands of years because it has this potential to be a very powerful natural antibiotic, antiviral, and antifungal agent. And in cases of septic arthritis or reactive arthritis, it's very helpful. Definitely weight management comes into play because we're talking about things like osteoarthritis and bone rubbing against each other and actually having issues with each other. Now, Garcinia Plus is unique in the sense that it contains hydroxycitric acid, which hinders conversion of carbohydrates to fat. Being overweight is synonymous to actually being fat, and it's also a natural appetite suppressant for people who are hyperphagic, who have the hyperphagic simply means have a higher tendency to want to eat more and more often. THEM also promotes thermogenesis, which is the process of burning fat into cells in the energy, thereby reducing weight in the process. Forever Lean contains chromium trichloride, which helps regulate metabolism and the use of carbohydrate, and hence helps to reduce weight. Now, there's a beautiful combo pack specially designed for a 9-day detoxification and weight loss program that systematically helps with weight loss in a matter of days. I want you to bear in mind that there's a constant battle between factors that help to repair our bodies and those that also help to break it down. I always suggest that we should always be on the winning side. Thanks and remain blessed.